So why are daily visual checks carried out? So each day you can monitor small changes in behaviour to identify if there's something more serious, and monitor small changes in health. It doesn't cause too much stress, and you don't need any handling technique. So if the animal's pregnant or ill or aggressive, then you don't need to restrain it in any way. Normal behaviour for cats and dogs: alert, responding to sounds, inquisitive, eating food and showing no weight loss. Ill behaviour might be that they're baring the teeth, growling, hissing, whites of the eyes, so maybe they're anxious and alert and trying to sort of see what's around them by opening their eyes and showing the whites of their eyes under some kind of stress. Excessive panting, Karen showing fear, shedding of fur and coat, sweaty paws, or an indication that they're making some hormone, maybe something like adrenaline, which is a fight or flight hormone because they're scared and anxious, or maybe something else like cortisol. Urine should be a light straw colour. It shouldn't be bloody or pussy, which might indicate a bladder or a kidney infection. Feces, cigar-shaped and dark brown. If they've got worms, then it might be a lighter colour, bloody or runny, an indication that they're not well. They've got some kind of intestinal worm. Excessive scratching might be a parasitic infection such as a mite or a flea. Rabbits, fairly similar. Withdrawing lethargy. Lethargy means that they look sleepy. Enlarged eyes, fairly similar, so extra alertness, showing that they're tense. And again, fairly similar for urine and feces, except sticky clumps in rabbits is normal because rabbits have a problem with digestion on first pass through their gastrointestine, things like hay and straw, and so it needs a second pass, so they re-eat their feces. Daily checks for goats, fairly similar. Stress behaviour might be stamping or pawing at the ground, but otherwise fairly similar to other animals. Chickens, moving around, dust bathing, so moving around in the dust is perfectly normal. Other than that, extra vocalization is abnormal. Pacing, loss of appetite, fairly normal. They don't urinate, so they don't make any liquid urine. They make urates, which is a solid, and it's white and black, or white and dark, similar to reptiles. If it's green or light brown, then it shows there's some kind of intestinal problem. Ball patches, damages to the skin are an issue. Bearded dragons slightly different because they're ectothermic, they're cold-blooded, and so they can't regulate their own temperature, so they need the temperature from the surroundings. Hissing and puffing up in defence is a sign of ill behaviour or stress, and again if they're aggressive. Then they don't make urine, so they don't pass urine. They make urates again, which is black or white. Signs of damage to the scales is an issue that might show that they've got mites. Behavioural and temperament checks important before handling, just to know if it's aggressive or if it's pregnant or ill or indeed venomous, etc., just to establish whether it's going to be safe to do a physical check or whether you might need some kind of restraint. And these are fairly generic, so I'll go through these quite quickly. Eyes, you always do this first while your hands are clean, so you don't pass on any infection into the eyes, which are prone to infection, so you do this first. And you're looking for clear, bright eyes with no discharge. Ears, no head tilt, no mites, which if they have a blood feed will leave spots of blood which will dry and cause reddy black spots. Nose should be moist, no discharge from it. Mouth, if you press the pink gums, they'll go sort of slightly paler, and then if you release them, they should go pink again within 1 to 2 seconds, which is called capillary refill time. Limbs and paws should be free moving. Overgrown claws, if they're overgrown, they've not got enough exercise to wear them down. They might need them clipping back. If they're overweight, then they might hold a paw up because they've got some kind of extra pressure on their paw, or the paws are cut. Glossy fur, normal. Plastic skin means that you pinch the skin, it bounces back into shape within 3 seconds to show that they're not overweight. Fairly similar for a rabbit, except a rabbit's nose is dry. Fairly similar for a goat, except a goat's nose is moist. Chicken again, fairly similar. They can get an overgrown beak, so you might need to trim that back if one half of the beak is overgrown against the other half. Scales on legs, so anything with scales, they shouldn't be sticking out. If they're sticking out not flat against the body and dull rather than shiny, it might be a problem. It might indicate there's some kind of mite or tick or parasitic infestation. And bearded dragons the same. A quantitative check, a monthly check, is measuring a number, so it might be a blood cell count, presence of bacteria in blood or urine can be sampled as well, nutrient levels in the blood or urine, an egg count. So an egg count is the worms, so they've got worms that produce eggs, larvae, then they can count the number of eggs, and that will give you a number, usually carried out by a vet. But only monthly checks for numbers. The other kind of things that you might check monthly in terms of number, weight gain, weight loss, temperature, pulse and respiration. Apart from a goat, it's only checked every 6 months because they vary too much, and so you only check them every 6 months. Weight assessment, checking weight loss measured in kilograms. Early pregnancy, they might gain weight. Young animals gain weight quickly, whereas older animals lose weight. Tend to. Losing weight shows a sign of illness, unless they're older, in which they might just sort of naturally lose a little bit more weight. You might need some kind of restraint to weigh them. Either cat and rabbit needs to be put on scale. Bearded dragons and reptiles can be put in pillowcases, and goats weighed in cages, and sheep too. A digital thermometer, then, you need to check that it measures in Celsius, and you need to check that it's clean. You might need to use some lubricant to insert it in the anus. You hold it for 30-60 seconds at an angle. Raised temperature is called hyperthermia. It might be that they've got some kind of heat stroke, maybe they've been out in the sun, been exercising, maybe they're in pain. Hypothermia is low temperature, maybe they're in some kind of shock, maybe they've got some kind of circulatory problem with their blood circulating around the body, or maybe they're pregnant and about to give birth. Pyrexia is a fever, so again they're hot, but it's a fever caused by a bacterial infection. They might also be in pain. Temperature sensor for cold-blooded animals, they're ectothermic, that don't make their own heat. They need the heat of the surroundings. Then there's you can't use a thermometer to do that, to test that. So a rectal thermometer inserted in the anus won't test the body temperature of a cold-blooded animal. If they're too cold, the bearded dragon won't be moving or eating. If it's too warm, it's got its mouth open, gaping mouth. But the only way really is to regulate the temperature of their surroundings, of the tank that they're in. Pulse checked, measured in beats per minute. You can feel at any point where the artery moves close to the skin, so that could be around the groin area or up near its heart as well. You don't use 2 fingers to check for the pulse. You don't use your thumb because you've got a pulse in your thumb as well. If it's too slow, then it might be that the animal's sleepy or unconscious or got too low a temperature, hypothermia. If it's got a high heart rate called tachycardia, then it indicates some kind of stress or maybe shock. Or maybe it's just been exercising too much or got too excited or in some kind of fear. And as I say, you don't use your thumb because you've got a pulse in your thumb. Respiration, so the breathing rate, measured while they're at rest, because if they've been exercising or get excited, then their breathing rate will be higher than normal. You measure it for 1 minute. If it's a slow breathing rate, bradypnea, then caused by sleep and consciousness. High breathing rate, tachypnea, then it can be caused by stress, pain. That's why the breathing rate's gone up, or too much exercise, excitement or fear. Or maybe there's an obstruction. That's why there's some kind of trauma and the breathing rate has gone down, or that it's difficult to breathe. Ketones, bacteria, so these are single-celled organisms. They're invisible to the eye. You can't see them except under a microscope. They need a host to survive, so they do not need a host to survive, so they don't need another animal to live off, so they could just live within the surroundings or in the atmosphere. in their environment. They've got a cell wall, whereas a virus does need a host to survive and reproduce. It needs another organism, another animal to live within. It's not a living cell as such, and again, it's only visible under a microscope. They don't have a cell wall. Fungi, sometimes called molds, yeast, mushrooms, these can be seen by the naked eye, and they live in the environment and again don't need an animal to live off. Examples of fungi, say for example, might be something like ringworm, might be a zoonotic disease passed between animals. Modes of transmission, so you can get direct contact when you touch something, touch another animal. When it passes an infection from an animal to a human, it's called a zoonotic disease. Maybe you'll come into indirect contact with blood, saliva, feces, etc. whilst cleaning out accommodation. That's why you always use PPE, personal protective equipment, gloves, etc. Vector transmission with biting insects. Zoonotic disease is any disease passed from animals to humans. Notifiable disease is a dangerous disease that needs to be passed to the health authorities. You need to notify them, let them know, notify them and let them know in certain cases such as foot or mouth or rabies. So notifiable diseases passed to a local health officer, reported immediately to local authorities, a local health officer and a vet, because it's got a high risk of being contagious to humans. Quite often infected animals need to be euthanized, put down, and the carcass is disposed of and burnt, and the animals need to be isolated. It's that serious as a notifiable disease. It includes things like foot and mouth, rabies, bird flu, sometimes called avian influenza. Preventing diseases then, good husbandry, cleaning, etc., vaccination against bacteria or viruses so they can fight off the disease, and then to prevent disease passing on, then you can isolate them or quarantine them, so put them in longer isolation, or even put them down euthanasia. Vaccines, so a dog canine paravirus is a rather nasty virus that causes problems with internal organ failure. Distemper, a zoonotic disease called leptospirosis, or infectious canine hepatitis is another bacterial infection in a cat. Infectious enteritis, herpes virus, that's a virus. Calcivirus, feline leukemia virus as well. In a goat, enterotoxemia, tetanus, and orf, sometimes called scabby mouth, where they get scabs around their mouth. A rabbit, mitosis, which causes lumps and also discharge from the eyes and the nose, as well as a virus. Bearded dragons, then no vaccination is required, really. There's nothing really you can do for those. Chickens, Marek's diseases, where all the eyes have a discharge. Bronchitis as well, where they have problems breathing. And avian flu then is another virus as well. Salmonella is a bacteria, affects dog, rabbit and goat, but it's also common in chickens and bearded dragons. Prevent it by isolating them and having good hygiene as well, cleaning, treatment, rehydrate them, antibiotics. For any kind of bacteria, antibiotics may solve that. High temperature, fever, lethargy, weight loss, and a zoonotic disease that can pass from animals to humans. Myxomatosis is in rabbits, which is a virus, swelling of the eyes, conjunctivitis, again swelling of the eyes, fever. Spread by mosquitoes and fleas, only affects rabbits. Ringworm is a fungus that's passed from animals, zoonotic disease in dogs, cats, goats, rabbits and chickens, and be passed to humans, and it appears as round rings on your skin. A parasite, an organism that lives on another called a host, so it's going to sit on the skin, Quite often nectoparasite is on the outside, things like mites and fleas and ticks. Vectors are things that bite, and endoparasitic is something inside like a worm. And then fleas, six-legged wingless insects. You can prevent them with spray. You can also use spot-on treatment